I have a question from Millicent, and I think it's a relevant one as well. So let's look at what she has to say. My lower back pain is caused by degeneration of the spine, first stage. Every year it seems to get worse. I was prescribed ibuprofen by primary, but now my cardiologist does not want me on ibuprofen. Resting throughout the day is what normally lessens this pain. What else can I do to get rid of this pain or correct the issue? A lot there, doctor. What do you have to say to Millicent?
So the question is, which is the source of their pain? Which disc is causing their problem? I would examine this patient, make sure that the hips aren't the issue, that it's really coming from the back. I would look at the MRI and then correlate the two. And then I would send the patient for an injection. Based on the result of that injection, majority will just get better, some will get better temporarily, and some won't get better at all, telling me that indeed that source of their pain is not the real source of their pain. So injections are a way to really correlate MRI findings, physical exam findings with what the patient feels. If we're real specific about patients' complaints, then we can address each and every element and expect to have the patient go back to normal, pain-free life.
I love hearing those words, doctor. Pain-free. And that's what we want for our viewers. We want them to live pain-free lives. Okay, we have another viewer named Robert, and he emailed us this question. Let's take a look right now. I got a nerve block injection from a neck pain problem on the right side and had a real problem with tingling in my arm, back, head afterwards. I got a nerve block injection on the left side a few weeks later and did not have the same problem. Doctor, can you explain why I may have gotten the reaction on one side and not the other? Doctor, what are your thoughts?
So, Robert, think of the things that cause pain going down the arm as either compressive or inflammatory. A steroid injection or a nerve block delivers a drop of steroids, which is essentially the world's greatest anti-inflammatory. So if the problem is predominantly inflammatory, as it is most of the time, the epidural injection is curative. It will take care of your symptoms. Usually, symptoms don't come back until your body creates more inflammation. However, on that other side, where you had the injection and it did not help, it would be good to see whether on the MRI there's a sign of real deal compression. Because if you have a compressive problem primarily on that other side, then an injection would either produce a short-lived result or, as in your case, it just won't work at all. If we're real specific about the diagnosis, then we have a much better chance of understanding these unclear outcomes and a much better chance of making an educated decision regarding whether it's reasonable to proceed with surgery.
Fantastic. Thank you, doctor, so much. All right. So I just want to remind our viewers that if you'd like to send in a question, it's really easy to do. Just send in that question to the email you see right there, questions@allhealthtv.com, or give us a call, 855-796-4475. And don't forget, you can also visit our website, allhealthtv.com. All right, doctor, we get a lot of questions from viewers, and one that comes up a lot is this one. Why does my back hurt when I sit in my car? Doctor?
This truly represents the majority of patients. Probably about 80% of patients say that they are worse in the car. So in general, when you sit, more so perhaps in certain kinds of cars, when you sit, your lower back, which normally has this nice C curve that's open towards the back, your lower back will actually change its shape to be less curved to the back. Essentially, what we call slouching is a normal response of your lower back. Well, when you slouch, more of your weight gets transmitted to the front of your mechanical axis. If we look at the person from the side and we find the center of gravity, if you lean forwards and you apply more pressure to the structures that are in the front, such as discs, sitting will then produce disc-related pain. And if those discs, which are like jelly donuts, with time they become wider and they start to touch the nerves, if you sit and you squish that disc a tiny bit more, just enough to touch the nerve, then you'll start to have severe symptoms going down the legs, tingling, numbness. So the typical symptoms that we call sciatica in the vernacular. So don't despair. If you have pain when you sit, that's usually a sign of a degenerative disc problem. And that's a problem that most of the time avoids surgery with some injections or can be cured with operations such as disc replacement, for example.
Just a reminder to our viewers, if you have a question, please send them in. It's very easy. Just email us to questions@allhealthtv.com. Give us a call, 855-796-4475, or just check out our website, allhealthtv.com. We have a question from Jody, who is actually concerned about her sister taking a long car ride. Let's see what she has to say.
Hi, my sister had 7 fractures in her back. I think 3 or 4 of them have been fused, but she had so many issues as a result of the fusion that she hasn't had the remaining ones fused. She was planning to take a 2-hour ride in each direction in a single day. And I'm just wondering, do you think it's safe for her, given the 4 hours of driving, to actually get into a car and drive that amount of time with the remaining issues in her back?
Jody, thank you for your question. Doctor?
I do think that it's reasonably safe, as safe as driving on the highway can be. That being said, if she does have a non-union or a problem where the previous surgery failed to work, sitting may be exceedingly painful. I would recommend frequent stops as much as possible so she can get out and stretch out. This is a kind of a patient who usually suffers tremendously, and these are the kinds of patients who I really love to help.
Thank you so much, Doctor. Now, Vincent sent us a question via email, and this is what he writes. Let's take a look. I have very weak muscles in my lower back. I would like to know if kyphoplasty could help get some height back in my spine. I also have calcium spurs, bumps on my back. What do you suggest? Dr. Busovanich?
So that's a great question. Kyphoplasty was initially intended as a procedure that would return the spine back to its original height. Some of the more recent articles really revealed that the restoration is pretty minimal. Kyphoplasty is really more indicated in terms of fractures, specifically compression fractures, fragility fractures, something that we get from poor quality of bone. With muscular issues, it would be important to rule out things like neuropathy. So you are kind of a patient that really needs a proper evaluation and a proper history. And similar to the previous patient, it's important to address bone health. So if osteopenia or osteoporosis are sort of common to your family, or if you've discussed these recently with your doc, I would highly recommend getting proper bone density tests. And if you are really at risk for fractures, get that treated with a medical solution as opposed to a surgical solution.
Great information.